A typical caregiver who's responsible for their loved one suffering from cognitive or physical disability have the following bundle that they can try to implement. We call it Caregiver Health Prevention Bundle. It's very, very simple, but it's very hard to implement. It has 4 elements. Number 1 is taking time off caregiving task. Not just physically taking time off, but also the most important one, psychologically taking time off. We even know how much minimum is this time off. Every week, if you were the primary caregiver of loved one who have cognitive disability in particular, you need at minimum to take off 8 hours from caregiving role, not just physically, but psychologically. That 8 hours cannot be 1 hour here and 1 hour there. This 8 hour has to be in a bundle, in one time slot. You can split it into 2 periods or 4 periods or 8 periods. So that's one component of the Caregiver Health Prevention Bundle. The second one is at your attendance and participations in monthly support group. You're becoming part of a social network of people who speak your language, have your perspective, are on the same journey of caregiving like you, so you feel that you have a backup plan, you have a community you belong to, and you have to attend that community at minimum once every month. The third component of the Caregiver Health Prevention Bundle is having specific and detailed crisis plan. We can predict what kind of crisis you will be facing in the future as a caregiver of somebody who's suffering from cognitive disability. And you should work with your providers on creating a crisis plan as detailed as possible and rehearse that plan and be ready for it. That's the third component. The final component of our Caregiver Health Prevention Bundle is coaching you and increase your capability on problem solving. You will be facing a lot of problems as the primary caregiver, and you need to develop various strategies on how to solve these problems. There's techniques that you have to learn how to do effective problem solving, how to communicate with your loved one to understand the problem, analyze the problem, come up with potential solution for the problem, implement the problem, evaluate if the solution worked or not. That kind of ABCD problem solving strategy are skill set that you're supposed to learn how to master. So these are the 4 components of our Caregiver Health Prevention Bundle. That bundle has to be implemented on a solid platform of effective communication. A lot of time, our caregivers, they are not well coached in communications with their social network, with their loved one, with the providers of the care for their loved one, and of their own healthcare providers. So they need to master communications and share their concern, their happiness with other people. So on the platform of great effective communication, you can put this Caregiver Health Prevention Bundle and you will accomplish amazing win-win. First, amazing impact on the health outcome, the quality of life, well-being of their loved one who's suffering from the disability. Second, amazing impact on their well-being, on their own well-being as a caregiver, their own quality of life, and their own health. A lot of our caregivers suffer or struggle from implementing the bundle. So we communicate clearly to them in the beginning and constantly that the bundle is a bundle. It's not just one of these 4 components. It's all in or all out. If you don't take the entire bundle, you're not going to be harvesting the benefits.